Okay, good morning, everybody. This is Keegan Hall coming you live on a Saturday morning. I'm the product and marketing manager at Ethitech, and this morning we're really excited about this live event regarding point of care and the value that point of care can add to a healthcare professional's practice, their patients, and the way in which they can manage people who are coming into their practice. And this morning, I'm joined by my colleague, Kagiso Molefe, who is the point of care business consultant for the Pretoria and Polokwane region. Kagiso has been with Ethitech for a number of years now and has really started to prove, how the growth of point of care in those specific areas is really beneficial for many, many practices, doctors, and patients. And with that, it all comes down to relationship building as well as being a business consultant. And Kagiso, really does have the epitome of that. When we asked him to get in touch with one of his key opinion leaders, his healthcare providers, his customers, he had one in mind, and that was Dr. Kagiso Molefe. Dr. Molefe is a family practitioner, general practitioner in private practice since 2002 in Temba Hammanskraal. So he's been there for 18 years. He has a special interest in treating chronic conditions, especially diabetes, and runs a fully fledged diabetes care program in Temba with a dietitian and a podiatrist on site. His ethos is to render a practice of excellence to his patients and limit complications by maximizing their health prospects and outcomes. So we are extremely excited, and we are very grateful for you, Dr. Molefe, for agreeing to join us this morning. Kagiso, I'm going to hand over to you to have a great conversation with your key opinion leader, with one of your top customers. And we're really excited to hear the insights from you, Dr. Molefe, in the sense of the value that point of care adds to you as a doctor, to your practice, and to your patients ultimately. Thank you.
Thank you very much, Keegan, for that introduction. Welcome, Dr. Molefe. Again,
thank you for making time. And thank you, Keegan.
Thank you for making time to be part of this. Doctor, just to start, to get a base, and Keegan has highlighted that you are a GP who sees a chronic patient in your practice. To touch base, what the devices that you have, I know you have in your practice, which is a multi-parameter device, and also the F100 that you just acquired, and also the DocuReader for urine. What's the benefit that you are getting from using those devices?
All right, once more, thank you for you guys to invite me to this webcast. It is really a privilege and honor for me to be able to share my experience with other listeners or viewers, so to say, as far as your products are concerned. I've been using these products for quite a long time. I started first by acquiring the Affinion, and later on the fluorescent analyzer and the DocuCheck. And there are multiple benefits that I have actually experienced from having these devices. First of all, as far as benefits are concerned, you get your results immediately at the practice. And then that's good for patient satisfaction, because often we tend to draw blood and ask the patient to come back the following day for results, or even in 2 days for results. But with this, patients get super satisfied because the results are there and then. And you make a diagnosis on the spot. There are certain conditions that cannot wait for long, and you tend to tell your patient that, look, this is what is happening with you, and we're going to deal with it this way on the spot, based on the results. And as far as correct decision making is concerned, it is of utmost importance.
Okay.
And since I got the fluorescent analyzer, the F1, just to say an example, after I acquired that device, which can also, among the tests that it can also do a D-dimer. The month I got that analyzer, you won't believe it, I managed to diagnose 3 pulmonary embolism patients on the spot and referred them immediately to hospital. I mean, had it been before, I would have actually had to draw blood, send them home. Maybe they complicated home while waiting for results. But with these patients, as colleagues might know who are listening, that a pulmonary embolism is a medical emergency. It's a do or die thing. It can kill a patient there and then. And I actually sent those patients immediately to hospital, and they survived. So it's quite important to understand the relevance of these devices to modern practice. Another thing is that patients are impressed at the thought of getting investigated thoroughly. Most patients are referred to my practice because they tell them that, look, there you're going to be worked up. I mean, you're going to be investigated thoroughly. It's not just going to be a doctor listening to you with a stethoscope and dishing you out medication. So it's a benefit for the practice. And obviously, as a doctor, it boosts my confidence, and I feel I'm professional. I feel I'm doing things the right way, as opposed to thumb sucking at times, as often as often as practitioners do. And another point that I like about these devices is that, as clinicians these days, patients come to us with having been to Dr. Google.
Yeah.
And you know what Dr. Google is. And I can dispute or put to shame Dr. Google there and there by just doing the spot test and showing the patients the result and saying, look, Dr. Google was wrong. This is what's happening with you, and this is how we're going to treat you. And I can assure you, patient numbers have increased due to the confidence that people have got in my practice because of these devices. And I guess that's just a nutshell of the benefits that I have as far as using these devices is concerned.
All right, fantastic, doctor. So with in the field, I always get questions of, will medical aid reimburse this? With your experience concerning medical aid, what can you say to the other healthcare practitioners out there? What's your experience when it comes to medical aid?
Yeah, of course, you'd want to purchase something that will benefit your pocket at the end of the day, and possibly pay for itself. Medicaid pay well for these tests. I've never had hassles with medical aids; they pay well, and but colleagues have to realize that you've got medical aids. Once you start doing these tests, they always want to verify whether are you really doing the test or claiming to be doing them and claiming for nothing. So it's very imperative that as you do these tests, you keep the results, the patients in the file, printed results. Printed results, because once in a while, one medical will just give you a shout and say, look, provide us with the results for this patient. And you cannot tell them over the phone. You will have to produce them a printed copy of the results, and they're okay with it. And once they are aware that you are doing these tests, they stop bothering you, because they know that you've got the devices. You're not just cheating the system. And once and another thing that is important is that colleagues must realize that once you're doing these tests, you've got to do them with relevance. You cannot just say to yourself that I've got these devices and I want to just do tests randomly. They've got to be indicated. You've got to do tests when they're indicated. Your diagnosis has got to support the reason why you had to do that test. And in that sense, you'll be at peace with medical aids.
Yeah.
And they'll pay you 1 year.
So
I hope I've answered you.
Yeah, no, you have answered me very well, doctor. That's why we at Ethitech, we always push for the doctors to have printouts for the results, so that they can able to dispute it when medical aids come against them. So one other thing, doctor, how's your confidence? You mentioned the D-dimer, that you had an experience with a D-dimer patient. You tested a patient with a DVT. So from your side, how would you compare the results with on point of care with the lab? Are you confident in them?
Yes, I'm 100% confident. The relevance is equivalent. I cannot say lab results are superior to our point of care results. You know, like exactly the patients I've referred to specialists. For example, those patients with a pulmonary embolism. There is the specialist on the other end verified the results for using the lab, and they were the same. They were the same. And the specialist actually wrote back to me, you know, to congratulate me and thank me for saving these patients' lives.
Yeah,
You know, so
that's great. That's great. Yeah,
there's no superiority or inferiority on the part of lab results as opposed to point of care results.
Yeah, no. So with point of care, you mentioned treating a D-dimer patient, doing a D-dimer test. So I've realized that most of the time you're also seeing diabetic patient. How's this has added value? I know you mentioned on the value that you've added on your patient, but I want specifically to highlight the issue on diabetic patient, especially testing for HbA1c. How has been the impact from your side?
Well, what made me actually first acquire the Athenion was because of diabetes. I mean, that's what pushed me to acquire that machine. And the Athenion is a machine that is tailor-made for diabetic patients. Of course, you can use the lipid panels for other things, but I mean, it's tailor-made for diabetes. And to tell the truth, my patient outcomes have drastically changed and improved since I used this machine. You know, to get my HbA1c on the spot, my lipid panel on the spot, your ACR on the spot, and you can discuss the result with the patient there and then, and you see them being interested, and it changes their behavior. You know, so and the fact that you can tell them, look, this is where we were, and after 6 months they come back and you say, look, this is where we are as far as results are concerned. It starts making sense to them, and it improves compliance. And my patient outcomes have been very very good and well received in the community. And what is happening right now, I'm getting diabetic patients who are referred to me, but unfortunately at times they get referred to me late. You know when they've already started to have certain complications. And when I compare them with my patient base, it's clear that we are doing well because of the support that we're getting from these machines. I rarely refer patients to specialists, diabetic patients specifically, or my chronic patients to specialists, because they're well managed. They're well managed. There's no need to refer. So the HbA1c from the Athenion, lipogram, the ACR, albumin creatinine ratio are very, very vital instruments in the management of my managing diabetes. Actually, patients who go into early kidney problems, you can pick it up with an ACR there and there when the albumin goes up, and you can maximize or become aggressive with your treatment to mitigate the effects of diabetes or whatever conditions on the kidneys. So you act on time and decisively.
Yeah.
That's why, not to brag, but really, patients love this and are doing well.
Yeah. No, great stuff, Doctor. So, Doctor, we were in a meeting with one of my my colleagues, and they were in a meeting with one of the big medical schemes in South Africa, and they want to make a point of care to be number one management when it comes to diabetes. So how do you foresee the impact of point of care in clinical decision making, especially in healthcare?
With point of care, for example, as GPs or family practitioners, we are the gatekeepers for patients to prevent them, actually gatekeepers to make sure that the only relevant patients get to go see specialists. With point of care, we will be able to provide a comprehensive primary health care environment that will make sure that patients don't get to complications. Patients don't get to a situation where they become more expensive to manage. And as such, there'll be a huge saving on the part of the healthcare payers in the country, because less complications, healthy patients means less spending on healthcare, and that's how I see it going. Right now, most medical aids have got baskets of the kind of tests that need to be done for chronic patients. For example, diabetes, they've got baskets of tests that they will cover, irrespective of whether the funds are gone or not, on those chronic patients. And with point of care, especially your type of machines, they are tailor made. It's as if when these guys were actually devising these baskets, we're actually in contact with you guys to say, look, we need this specific test to be tested on our patients, and we're ready to pay for them. And that's where you guys come in, and there is relevance. There is relevance of your point of care machines, or rather our point of care machines, in terms of mitigating the effect of diabetes or other chronic conditions on patients. Yes.
Okay. So, doctor, just to wrap it up, what would you say to a fellow healthcare provider who wants to consider point of care device or devices?
I would say they should have long done that. They should have long been in possession of these devices. They should have yesterday had them, because it's becoming a point where you cannot run a practice without having point of care. It's as simple as that. It's as simple as that. Of course, there are various tests that you cannot do in the practice, but I mean, there are those pertinent ones that are needed in the practice, and you guys are providing the point of care machines for that. I cannot, for example, I cannot wake up and say I'll go run my practice now differently without point of care.
Yeah.
It's gonna be a drag for me. It's gonna be a drag for me to work without point of care, because I'm used to getting my results on the spot, and I'm used to making my decisions on the spot and getting success at managing my patients. So they're part and parcel of practice. You cannot run away from that.
All right, doctor.
Yeah.
No, doctor, that's what we all we had, because we wanted to clarify the value that the point of care adds to a healthcare provider, especially a doctor like you who have seen a great value, and you have explained it in full how you have seen the value in your practice. So, doctor, thank you very much for this interview. Thank you for making time. Hopefully, it will add value to the other healthcare providers who are still having questions and doubting to get a point of care in their device, into their practices. Yeah. Thank you for your time, doctor.
Thank you, Katlego. Thank you, Keegan.